interact more. And all of those things are important for maintaining cognition. One of the first things that will affect cognition in Parkinson's disease is social isolation. When we isolate ourselves socially, we're no longer stimulated by conversation or stimulated by socializing with others. That alone, even without any disease advancement, will cause people not to do as well cognitively. That's true for all older adults. It's true for people who have dementia. It's particularly true in Parkinson's disease. We also know that exercise will help to increase energy, reduce fatigue, helps people to sleep better. When you sleep better, you think better. So I'm operating on about 2.5 hours of sleep right now, so you may not want to believe anything that I'm telling you. I may not be thinking well at all. You can thank Dr. Jog for that. I had a project that needed finishing in the middle of the night, so you can thank him if I'm not cognizant today. But the fact is that we all think better when we sleep, and our brain needs sleep to rejuvenate. We need sleep to generate our own natural BDNF. We need sleep to generate our own endogenous levels of dopamine that help to restore natural levels of dopamine, which is part of Parkinson's disease. Exercise helps you sleep better. Which program is best? Because we've got all these programs, and every year Parkinson's Society does a great job of having people come in and talk about exercise. Is yoga better than walking? Is walking better than lifting weights? Dr. Almeida's group at the Waterloo area does a lot of work on exercise programs in Parkinson's disease. Is there a best program? Nope, there's not. For brain health, the only key is cardiovascular. There may be better programs for stretching or flexibility or mobility. I can't speak to that. That's not my area of expertise. But I will tell you definitively that cardiovascular exercise or aerobic exercise has to be a component of it if we're expecting it to do something with brain health. Vigorous, by the standards that have just been identified by the American Academy of Neurology for vigorous exercise in Parkinson's disease, 20 to 30 minutes at a time. It has to be regular, at least 2 to 3 times per week, elevating your heart rate to 50 to 85% of maximum heart rate levels within your individual safety, which should be determined by a physician or the aid of an exercise therapist or a physiotherapist, and at least for durations of 6 to 12 months before we start to see perhaps permanent or connectivity changes in the brain. No single program, of all the studies I could present you, less than 10, they're all different. Some of them swim, some of them cycle, some of them do 3 days a week, some do 2 days a week. They're all different. So the precise type of exercise may not matter a ton. It's that you're doing it vigorously, that you're doing it regularly, and that it has a cardiovascular component. So barriers to exercise in Parkinson's disease, I probably don't have to tell you guys this. You could nod, shake your hand, and probably come up with more than I did. But we know that the slowness and stiffness and trouble with balance and gait can sometimes get in the way. We know that fatigue is a component of the disease, with about 40 to 50% of all Parkinson's patients complaining of significant fatigue. And when you're tired, it's hard to get the gumption to go out and exercise. That's true for everybody, particularly challenging in Parkinson's disease. We know apathy and depression get in the way of being able to do exercise programs. And a recent survey of physiotherapists in the US, a really nice study that's now echoed by an Australian group, actually cited one of the #1 barriers to implementing exercise program in Parkinson's patients as being concentration and cognition. It's the first time we've seen that evidence come out, that difficulty following the complexity of exercises, remembering the exercises, having to handle a lot of different exercises complicates the ability to do an exercise program in Parkinson's. And they also cite decreased awareness or insight into exercise benefit. So how do we get exercise into daily life in Parkinson's disease? I'm going to start following these because I have trouble getting it into my daily life too, because I'm tired. And I'm not depressed, but I don't have a lot of time. I mean, everyone makes their excuses. But what we know now is that the AAN, or the American Academy of Neurology, has said that for Parkinson's disease, educating patients on exercise is now considered best practice. So just like evaluating them and starting Parkinson's medications, exercise should be part and parcel of every plan of care for every patient who has Parkinson's disease. Exercise in some form at some level. So that's how much we know now it benefits both physical improvement as well as cognitive improvement. The same thing can actually be said for care partners. So I didn't go into that a ton here, but we actually have good evidence to show that care partners of people who have Parkinson's who engage in regular exercise actually experience less depression and less complications of caregiving. So it's true for both care partners as well as people with Parkinson's disease that exercise is important. Physical level of exercise, because I'm advocating for cardiovascular exercise for brain health, should always be checked with a physician. It should always be done with appropriate supervision and care partner support. So for me, this is a great way to get everybody in the Parkinson's household exercising. Everybody has to participate, and it will benefit the entire unit within the family, not just the person who has Parkinson's. But this we know, and we have definitive evidence to this, general instruction is not enough. So when you go to the doctor's office, and I work in a medical practice, so I see it all the time, you go into your doctor's office and they tell you exercise is good for Parkinson's, just do whatever you want, but just do it regularly. And that's about the only instruction that you get. If you're lucky enough and you're one of Dr. Gutman's patients, because Dr. Gutman actually has an OT who works in his office who exercises on very specific, or who teaches on very specific exercise programs. But most physicians' offices don't have that. You will get just a very general instruction to exercise. We have now 3 studies published that say that does no good whatsoever. So while physicians know it is their best practice to educate you that exercise is important, the information they don't have yet is how to teach you how to exercise. And that's one of the complications with putting these practices in place. We know also that general physio is not enough. So just doing walking training or balance training, what we call gait training and strengthening, is not enough. So if you're going to go see a physiotherapist, and one of the recommendations of the AAN, in particular the article that David Burns wrote, is to say that physicians should actually write down on their prescription when they send you to physio, general strengthening and cardiovascular exercise program, right? That you actually need to tell your exercise physiologist, because the assumption is when people go to a therapist to be seen who have Parkinson's disease that it's always for walking and balance. If physicians actually need to provide the direct request, I want you to provide them with a good exercise program, with a cardiovascular strengthening exercise program, not just training them in gait. And these are some of the recommendations that come out of the ParkFit study that I was telling you about. We know that exercise programs should be given with simplified instructions, that we should not give too many exercises at one time, and we know that exercises should be reinforced with both written information, pictures, verbal, visual information, that this is really important. Just telling people with Parkinson's how to do the exercises doesn't work. And I will tell you this is true even for speech exercises, because I've done this a long time. If I just told my clients how to do it, never worked. And I actually used to do that as an experiment. Let me just tell them and see if it worked. It was incredibly mean. They'd come back 3 days later, they had no idea what I told them. Because it's hard. It's hard to remember all that in your head when you're going home and engaging in your regular life. So it is important to show, to demonstrate, to give pictures. We know that long-term follow-up is essential. So a one-time instruction on an exercise program is fine for someone who has heart disease, is fine for someone who has kidney complications. It is not fine for someone who has Parkinson's disease. Any exercise program that is going to be worth doing in Parkinson's disease has to have long-term and ongoing follow-up. One, because the exercise program needs to be tailored and modified over time, but more importantly, because PD patients need that to keep them engaged in the program itself. So what are some of our new directions? Well, there's a couple of them. Animal studies looking at the neuroprotective benefits of exercise. We do have a few of those that actually show that exercise may be preventative as well as slow down some of the risk. We don't have that in humans yet. There are some early animal trials that tell us that. We know that exercise programs that specifically address cognition and language are certainly coming down the road. And there's a National Institute of Health in the U.S. funded study to the tune of about $2.6 million right now that's looking just at the benefit of brain training programs and physical exercise on cognition only in Parkinson's disease. So some of this data certainly is coming our way. It's being done at the University of California. We know that virtual reality is there, that training in context, creating simulated environments is important. We do this in our own lab. We have a virtual reality lab that we do gait training and exercising in, where we actually put you in an environment that makes you feel like you're in the grocery store, makes you feel like you're crossing the street. That's work that's actually funded by Parkinson Society, not Parkinson Society Canada, but by the Southwest office. So that's actually a project that our direct area funded. There's also been some work done using treadmills in virtual reality so that you're perceiving not just that you're walking on the treadmill, but that you're walking on a treadmill while stepping over obstacles or walking in a woods. Miralman and colleagues in Jerusalem have done a bit of this work, and they show that it drastically improves walking as well as dual tasking as well as thinking to train people in that type of contextual environment. And as I said, we're looking more at dual tasking. So this is really about the last 2 years, and there's a whole host of really interesting studies that are coming out now that we do them in our own lab. I do some of this work with Dr. Scott Adams, where instead of just having people work on their speech, we had them work on their speech while walking. We had them work on their speech while doing other things. And we're actually finding that treating in that dual tasking condition is making a substantial improvement in speech, a substantial improvement in walking beyond if we just treated those two things separately. So we're no longer in that realm of saying, only do one thing at a time. We're saying be careful if you do them more than one thing, but we're going to train you doing two things at once so that we make you better than if we trained in each one separately. So as a bit of a conclusion, and I'll take a few questions if you guys have any, just to summarize, we don't have hard evidence yet. So you can't go to your doctors and say, that woman told me that it's going to make me better, I'm never going to get dementia, I'm going to be really smart. No, you cannot. Do not go tell him that, because they're going to call me and say, what is wrong with you again? So you can't, and they know me, so don't go ruin my reputation that way. It doesn't work that way. What I am telling you is we have preliminary suggestive evidence. We have confirmed evidence that exercise helps physical functioning in PD. We have hard confirmed evidence that exercise changes cognition in healthy, normal aging adults, as well as adults who have dementia. We have suggestive evidence that it has the same benefits in Parkinson's disease. And I really hope that that's just a function of us needing to do our homework better and gather more evidence. And there's no reason to indicate that it isn't. We know that cognitive benefit is linked to cardiovascular-based exercise. I've said it over and over again, but it is actually really important to remember that fact. We know that dual tasking and context are important, and we know that general exercise is not effective. It has to be specific, meaningful, interesting, ongoing, simply instructed, long-term follow-up. So that concerns me when I look around me and I see a lot of our community-based exercise programs as just being something that someone drops into once, gets taught how to do exercises, and then goes home with the expectation they're going to do them on their own. My concern is that doesn't work very well. My anecdotal evidence from working with many of you in clinic, as well as working with many of you in research studies, is that's also true. You got this great exercise program from a therapist, great exercise program from a community program that you went to, but you go home and what I hear from your partners and what I hear from you is you don't ever do it, or you pick it up on occasion. When I asked you the first question about how many people in this room exercised, a quick show of hands showed that that was only about 10%. If we believe this evidence about physical functioning and cognitive functioning, the number of hands that go up should be around 80%. So now I'm going to re-ask the question. After this talk today, if I come back in a year and I ask, how many people in this room exercise regularly, how many hands will I see go up? Perfect. Now, I'm going to hold each of you accountable for that. And those of you who know me well know I have a photogenic memory that's about like an elephant, and I don't forget anything. So I'm going to remember that you raised your hand. And both hands. And when you don't raise both hands next time, I'm coming after you. No. And I'm from the South. We know how to do that. So I appreciate all your time today. I appreciate all your talk. Just a quick thank you to the people who make my life possible. Certainly Parkinson Society Southwest Ontario has always been a huge supporter of my work and is in large reason that it's made it possible for me to quit my job and go back and do a PhD now. Parkinson Society Canada, as well as all of you. I learn from all of you. you become the research subjects that I work with, but most importantly, you help inspire me to do what I do every day. And then, of course, the labs of Dr. Orange and Dr. Jog and Dr. Adams. So I'm happy to take any questions, because I don't think we're breaking probably about right now, but I can take questions. I'll just kind of stay up around the front, and you guys can come up and ask me anything if you have a question, okay? All right.